Eleanor. Welcome to the show. I would like for you to tell our viewers what you do professionally.
Sure. I am a healthcare chaplain as well as a Unitarian Universalist minister. And at the time that I understand we want to talk about, I was just getting started in the field of healthcare chaplaincy. And specifically, I was working in hospice care. And since then, I've gone on to work in more acute care settings.
Nice. So that shows your expertise in the area. And I'm excited to talk to you because not only do you have the professional training, but you also have personal experience that you've had to balance based on your career. All right. So, starting out, my vision for this conversation is to talk about, as I mentioned, your lived experiences and as a bereaved caregiver and what your hospice experience looks like in the care that your mother is now receiving just as an aging adult. So, we'll get started with that. What do you think is most important for viewers to know in general when they're dealing with their parents aging?
It could vary a lot from person to person, but I think the thing that was most surprising, that we were most unprepared for, even in spite of the diagnosis and the decision to enter hospice care, when my father actually died, he went quite suddenly, or at least that was how it felt to us. And I even remember asking our hospice nurse slash case manager, did it feel sudden to her? And she said, yeah, definitely. It was not one of those long 3-day death watches. We were talking with him on Zoom and we had a really nice time. And the next day, we contacted the facility to say, when can we do that again? And the following morning, he died. It was that quick. And it was complicated, of course, by the pandemic. We couldn't be with him, but he was so seemingly active, eating a good breakfast and waxing happy about the bacon and eggs. Everyone loves that. And then one day, he still ate breakfast, but he didn't really eat much at lunch or dinner, which was typical, but he died in the middle of the night.
Wow.
It doesn't matter how well trained you are.
When it's personal and the experience is much different. Can you tell the viewers, did your father have repeated hospitalizations or what's his diagnosis? Just to, again, contextualize what that experience looked like for you.
He actually did not have a lot of hospitalizations. Maybe every few years had been hospitalized because of heart issues. So we were aware the fact that he took a lot of medications, he had a stent, he had never had a heart attack, but we were very tuned in to the cardiovascular area. Then it turned out he had symptoms that led to him going to see a urologist, and the urologist found that he had prostate cancer. And this was not
Wow.
news because he had some kind of very, like, almost benign, very slow growing, not worth doing anything about because probably something else is going to kill you first kind of prostate cancer. It had always been in the background, but then the urologist said it looked like it had metastasized and it had gone into, I don't know whether it was the liver, the bones, or what, but to my ear, I immediately knew to ask, do you think hospice care is appropriate? And the nurse practitioner said, "Yes, absolutely. At his age and overall condition, there is really no way of treating, especially the metastasis." And we had a really detailed conversation with the hospice medical director. My two siblings and I on the phone. Again, this is all remote and distant because of the pandemic. And she said he might have a bounce at the beginning because he's not undergoing invasive treatments. He can relax, he'll get more services. And that was actually true. He had a couple months where things were on an even keel, and I wouldn't say back to normal, but I think for my mom, it was probably more like back to normal, except for the fact that he was getting visits from people to help him with stuff, which my mom did not buy into at all. But that was over the course of the fall, and then it was right after Christmas that he died.
Yeah. What triggered your thought, is this time for us to consult with hospice? What brought that to mind for you when you spoke to his physician?
The metastasis. The way they described the cancer having traveled to parts of his body that wouldn't
Mm.
be able to be removed, like bone.
Do you think your professional training helped with that as well to direct
Oh,
your
yeah.
decision?
Yeah, because I knew how to ask the question in such a way that I could get the answer I was seeking, because I knew to say, "Would you feel it's appropriate?" as opposed to, "What are you recommending?" Which is a
Absolutely.
really simple, small distinction, but it gave them the comfort level.
To have that candid conversation. So knowing how to ask the right questions is important. Sounds like that's the case.
In this situation, it really cut through a lot of the things that I see with patients in the hospital when, like, palliative care is being suggested and they are just not hearing it because the care provider knew right away that we had a level of readiness.
It's a difficult conversation to have. I would expect for providers, even more difficult when you know your family member or the patient isn't where they are at that point. And we miss a lot of conversations because how do you navigate not diminishing someone's hopes?
It really was the metastasis when they described the way the cancer had traveled and looking at the total health history. With my background of meeting with people very quickly after hospice intake and knowing that it's really hard for a provider to say, "We don't have anything left to
Right.
offer." But when I heard them say that, then I knew I could push that envelope a little bit, because I did not want, and I knew my dad did not want, invasive futile treatment. It was just clear that even with him having a degree of dementia, it was important to him to know that whatever was available and appropriate that could improve his comfort, his dignity, his independence would still be offered. And it was really important for me to hear from him a few days later. He said, "They explained, if I fall down on the floor, they're not going to leave me." That was really important.
So once you made the decision or had the conversation, a lot of people need to then make sure that everyone's on the same page. Was it a difficult conversation to have with your siblings? And then your mother is still living. Was she able to swallow that pill?
She really didn't want to. She claimed as if she understood what it meant, but she just shut down and wouldn't deal with it. In retrospect, especially seeing her now, because she's not in hospice care because she's not sick. She's just decided she's not dealing with a lot of things. And it's almost a level of dissociation. I don't know if that's the right word really, but it's like she does not feel pain, even when she's wrinkling up her face and saying, "Ouch." Then you say, "Did that hurt?" "No, it didn't hurt. I don't
Mm.
feel anything. I'm fine." I wonder if she was already starting to do that in regards to my dad's situation of just having a very high level of not being tuned in to the physical nature of things. Sometimes she would say, "Oh, he's just had breakfast and he's already having a nap." That actually is pretty normal in this population. But she considered it to be, like, irresponsible, like he was lazy or something.
Mhm.
So, it was really hard for her because I think there was some way in which she was never gonna let go.
And that's common?
I have never seen anyone quite like her. You never see your parents in the same light, but I have seen other spouses that really weren't seeing what the clinicians saw.
And
That
how old was your father and how old is your mother?
my dad was 88 when he was in hospice, and my mother would have been 86, and now she's 91. It's been 4 years since he died, and so with her ongoing decline, it's, "Oh, now I see that could have been a pattern." The things that she doesn't see about herself and the care that she needs are really similar to the things that she didn't see about my father and the care that he needed.
It's amazing to see certain threads across families' experience. Every experience is unique, although there's some part of this section of life that threads from one person to the next. Your parents have their own personalities, the next person's parents will have their own personalities, but there's this common human experience across each family member that we
Mhm.
see in the field.
And I think that in maybe the last, say, 15 years of my parents' life together, my mom really became fused to my dad. She just became more dependent. Even though she knew that she would probably outlive him, she stopped doing the things that a person would do who's there's a high likelihood that I'm gonna be without this other person, like building an independent life, building relationships with other folks. So, really constricted, partly because of, choices that she made a long time ago.
That kind of seep into the future. That's some great insight.
So it's like the hardest thing as the family caregiver is respecting that these choices that were made a long time ago for whatever reason and whatever value system that was certainly brought up with in this family, but I might have changed a little bit on my own accord, that those have consequences and that I don't have the power to modify the consequences very much. I can do a little, but I can't change the big picture.
How do you swallow that pill and what do you do knowing the value system can't be changed, but that there's still a life that changes? How do you balance that? And I'm glad you brought that to light. Even in my own family, there are things that we have to respect and swallow as my own grandmother ages. And we had actually come to that aha moment. People are going to be who they are from start to finish for the most part, and value systems do, as you mentioned, have consequences and color the way people are aging. And so how do
Mhm.
you mitigate that?
That's kind of a spiritual question because it's really about the rub between the respect for the dignity of every person, which is a spiritual calling, and the respect that, they have been independent. They made their own decisions according to their value system. And this is where kind of the modern age becomes something that you start to problematize. Independence is not all there is, because independence is also a myth. We
Mm,
do not exist without one another, and we are truly interdependent in the way that we live together. I might go live on the other coast and not see my family for 30 years, but they're still inside me. And so
mhm,
we are interdependent in economic ways, interdependent in emotional ways. So, how to respect someone and then also care and provide the care that they still deserve, even if I'm really angry. And I have been, not so much with my dad, but there have been times when I've been really angry with
mhm.
my mom. But
Yeah.
to respect and still care, what I am choosing to do is to make myself available for her so that if there's some little thing where she wants to assert something and wants family support for that, I will give that to her. I will encourage her to ask for what she wants and decline what she doesn't want, which is much more common because she wants very little. She mainly wants to be left alone. But with my dad, the thing that was just the most tragic about it for me and probably for my siblings was the pandemic, because we couldn't make ourselves available in the same way. It was just not possible. And the facility made certain decisions and restrictions that they had, like the cleanest place in probably the country, but they were not compassionate
Mm.
in terms of the needs of individual families. And it was really hard because we couldn't see him. My mom couldn't see him. This Zoom thing, we were only able to do once over 3 weeks that he was in that section. And even when he was with my mom in their apartment, no one else was allowed in. I couldn't go. They just didn't provide for that. It was a lockdown. And that was a loss that thousands and thousands of people had to sustain in one way or another. Who knows? Maybe if they had been more liberal about us, more people would have died of COVID. I don't know. I will
Yeah.
never know. So that's like a whole social cultural level of loss that I can't rationalize because I did want to be there.
Did that cause any, in retrospect, any more turmoil than the experience was already putting upon you?
Probably to some degree, and it means that I am probably more grateful for every chance that I have to go see my mom now, but I'm also scared. As of the 3 children, I'm the one that's there the most frequently, between 2 and 4 times a week, and I don't know what my life is gonna be like when I don't have that to do anymore, and she's not there. Even if I'm frustrated, it's like a big part of my life right now. So, just like I worried about my mom not having a life other than my dad when she told me right out she knew she was probably gonna outlive him, and now I'm worried about myself having a life without either
Mm.
parent.
Yeah, as difficult as these journeys are, there is some level of meaningness that becomes a
Mhm.
part of the families or caregivers' lives. And then all of a sudden, you mean to tell me that's gone? What do I do in the morning? And many people say, I still got up to head to my mom's house and started to prepare breakfast.
For a
Do you
person that was there.
Yeah, do you start to work on that reality ahead of time, or is it something that you think you'll just try and manage at that time?
That's the thing they call anticipatory grief, right? So For me, it's really important not to overdo it. But if you are a person who tends to anticipate things as I am, it's natural to want to think through things. And that's a balancing act to think it through. In life, there's always a dance between saying yes, saying no, saying maybe, and saying, I got to let that one go by.
Yes.
And I'm not good at letting it go by.
So
But
anticipatory grief, you're making a good point, is a protective factor that
Mhm.
may or may not be protecting the reality of future emotions in the way that we hope that it will.
So it's good to be proactive, but also relinquish control.
Absolutely. Which is
Whew.
spiritual as well. It's spirituality. It's something to hang on to when you need something more than what you can see. I think that spirituality is important, and thus the importance of chaplaincy and spiritual counselors. And it's
Mhm.
a good thing that you had that foundation, that you have that grounding.
And it's one of the reasons why I love doing the work because I can see and feel when I'm working with others who are going through this that their confidence level can build. People say, oh, get the chaplain to come and comfort, make all the pain go away. It's really not like that.
We're just as
I offer to
dumbfounded
make
as they
fun,
are.
but it's confidence of, okay, I might not like this, but I get it. And then it's also clarity of, I don't like this. I don't get it, but it's real and I'm here and I do have tools. I do have
Mhm.
resources
Yes,
and getting hold of those and then just doing the best you can.
absolutely. Any closing words or encouragement that you would like to offer people who see this interview?
I would just say it is hard. There's nothing that makes it easy. It's more resourceful. Once you realize that whatever medical condition can't reasonably be expected to be treated, it's really a better way to do things than the conventional medical approach.
Great closing words. I think all in all, we need to remember the human element, the human experience. Thank you for sharing your story. I know it isn't the funnest thing to think back to a very difficult time. Much gratitude to you for giving us your take on health.
Thank you so much, and I hope that this will help others as they go forward in their own life journeys.
Reverend Eleanor Piez, everyone.